Good evening and welcome to The Story. I'm Evan Watson in for Pat Doris tonight. 2 years ago, I started reporting on Oregon's flailing mental health care system in my Uncommitted series, specifically civil commitment and involuntary treatment, and how so few people with severe mental illness actually get treatment and care before something bad happens. Our reporting helped kick off a 2-year judicial department study of Oregon's civil commitment system, with all the invested parties joining the conversation. Their final report is out now, and it's our big story tonight. The Commitment to Change work group promised an exhaustive review of Oregon's complex mental health care and civil commitment systems. And they certainly looked at everything, producing 129 pages on how we got here, statistics, pitfalls, and ultimately recommendations for change. I read it all, and it's a fascinating and valuable explanation of this crisis with good ideas to expand outreach, develop and fund alternative places for treatment, and better track civil commitment cases. But it leaves a lot of work up to lawmakers in Salem to create any meaningful change, something they have not been able to accomplish in recent years. Here's Jerry Clark, one of the work group members.
The recommendations are, I would say, quite gentle. So my hope is that people who review this report go beyond the specific recommendations that achieved consensus and look further to what is the data showing us about what's happening in the state of Oregon and where there are unmet needs.
When she's talking about gentle recommendations, she's talking about the unanimous ones. There are other ideas in the report that say not everyone agreed here. Now, Clark founded Mothers of the Mentally Ill, an advocacy group for families. You heard her mention consensus, like I just mentioned. It's really tough to get 100% of people to agree on anything, let alone mental health reform. So that's one reason why some of the work group's recommendations are not as strong as many hoped. You may remember earlier this year, we shared an update to our Uncommitted series explaining how Oregon has effectively criminalized severe mental illness. Our system waits for someone to commit a dangerous crime or harm themselves before providing care. We told you about the Graham family. Austin Graham, in the middle here, was experiencing psychosis, and his parents on either side did everything, even guardianship, to try and get him treatment. It wasn't enough.
The statutes got in the way, and he was sent home very psychotic and killed his mother. There's nothing in the consensus recommendations that provides a remedy for what happened. The status quo will continue to allow that type of harm to happen.
Clark says the work group's biggest miss was that they failed to redefine dangerousness in Oregon law. Each year, Oregon courts receive nearly 8,000 notices that a person's mental illness is so severe it's causing them to be dangerous to themselves or others. Just 6% of those people reach the current legal threshold for civil commitment, forced care, and even fewer actually get treatment. So advocates like Clark say that standard needs to change.
Not defining dangerousness in statute makes no sense. And the fact that the CTC could not even agree that the statute needs to define dangerousness is a little mind-bending to me.
Now, there is another perspective and a big reason why there was an agreement there. Forcing someone into mental health treatment is not a decision that should be made lightly. Disability and personal rights advocates are quick to push back on anything that could make it easier to take medical decisions away from the individual. The challenge is, what if someone doesn't realize that they're dangerous? I talked with some other members of the work group to see how they felt about the report after this 2 years of intense study. Another work group member told me he felt this report ended up being about an inch deep and a mile wide.
Yes.
You agree with that?
Yes, I like that. Mm-hmm. An inch deep and a mile wide.
What does that mean to you?
We needed to go deeper. We needed to go deeper. We needed to be real about the situation of people who are suffering in plain sight across the state.
The priority should be
ensuring that people receive treatment prior to tragedy Currently, the requirement is that the tragedy has to happen first.
The report is very clear. This is an in-depth resource and recommendation guide. It's up to lawmakers to create actual change. Lowering the standard for civil commitment in Oregon has been pitched 3 times in the last decade, and it's failed every time. Clark says it feels different this time around. She thinks this report will fuel a legislative push when the long session begins in late January.
It's never been more obvious to the general population that people with severe mental illness, especially psychotic conditions, are being neglected and abandoned by the system. I think the time is now to make that happen. And the families that are part of my constituency are prepared to testify and share their stories so that lawmakers truly understand the risk of inaction.
Now to an update on that exclusive story we brought you last night here on The Story. Immigrant families arriving in Portland in hopes of housing and work, instead being handed tents and sleeping bags. Today, Blair Best talked with county officials tasked with helping immigrant families to find out why some are being left on the streets.
This month, more immigrant families are migrating to Portland at an unsustainable rate. Mothers like Jamie, who we first met on Wednesday, say they're told it's a city with available jobs and housing.
Esposo y yo. Pido ayudas por aquí, por allá, pero pues no me ayudan.
Resources in Multnomah County are at capacity, so families like Jamie's end up homeless instead.
Que por favor me ayuden y que se compadezcan de nosotras y de mi bebé que está muy chiquita para llevar este frío en la calle. De verdad, ayúdenme.
We are working very hard to provide support and shelter for families.
This is Rachel Pearl, the Deputy Director of Multnomah County Human Services, the group the county chair tasked with responding to arriving immigrants.
We're working in partnership to ensure that families who arrive understand what resources are available. You know, there really isn't a coordinated sort of entry process at this point in time.
KGW found what ends up happening is families arrive at the airport, head to a nearby motel, where they're given a list of shelters, many with long wait lists, and handed tents and sleeping bags. On Wednesday, students at a Portland trade school built them this temporary shelter.
Overall, it's a resource around family shelter issue.
There are currently 3 family shelters in Multnomah County. The wait lists are more than 6 months long.
Yeah, so we have limited resources and we're supporting as many families as we can with the limited resources that we have while we look to a longer term solution. And that's the situation that we're in right now.
Multnomah County does not track the number of arriving immigrant families. Numerous groups are trying to help them, including the Interfaith Movement for Immigrant Justice. And they tell us they are currently in touch with 7 families with minor children sleeping in cars or outside. And the Salvation Army is, quote, actively working to find appropriate shelter options for them, though there are limited beds currently available for families in Portland.
Nos habían comentado que como es ciudad santuario, podíamos conseguir un mejor bienestar para nuestra familia, trabajo, refugio.
Blair joins me now in the newsroom. Blair, does the state play a role here at all?
Evan, they do, and the county says they're working with them. They say it's not solely up to them to be responsible for what's a national crisis. Today, Governor Tina Kotek's office declined our interview request. And something I wanted to point out is that county officials say when they do have available shelter, sometimes they offer it to immigrant families and they decline that offer. Here's why.
In general, what I know about some families is that families have been offered services and resources that sometimes they feel like aren't going to work for them for a variety of different reasons. There's a tremendous amount of fear that families that are navigating immigration status and sort of navigating being a newcomer in this country have, and a lot of that has been realized for them. So going into an organized space can often lead to feeling insecure and vulnerable, and also there's been some safety considerations that families have felt didn't align with what they wanted. So we do have families that have chose to sleep outside instead of taking advantage of some of the resources that were available.
Blair, I noticed in your story, Andres said they told him Portland is a safe place for his family. Who is they? Do we know who's sending these families here when our resources are limited?
Evan, we don't exactly know who's telling them to come here. I do know, while some I talked to are originally from Venezuela, some do not have documentation, and we're hoping to get that here. Now, they've been in other states previously, like New York and Ohio, and one family I talked with was staying in Florida, but lost their home in Hurricane Milton and were sent here. Evan?
Okay, a lot of viewers have reached out to us asking how they can help. What should they do?
Yeah, this story really hit a chord with so many watching at home, and really their best bet right now is to get in touch with the Salvation Army. More information on how to do that is on our website right now at kgw.com.
Thank you, Blair. Appreciate it. Up next on the story, after months of preparation and weeks of initial delays, new data on deflection in Multnomah County. How many people have accepted the offer of services instead of jail, and what treatment providers are saying 1 month after the center opened. That's all next when the story returns. It's been exactly a month now since Multnomah County's Drug Deflection Center opened, and it's been a slow start. Just 13 people started the deflection process over the course of the first 2 weeks the center was open. The Coordinated Care Pathway Center is up and running just off Southeast Sandy. When people are caught by police using drugs in public and they aren't committing any other crimes and they don't have any outstanding warrants, police can drop them off at the deflection center where they can be evaluated for things like drug treatment services, housing, or mental health services instead of going to jail. At least that is the goal. Today, Multnomah County gave an update into how things are going. They say they're working to connect people with services, but that those services don't always exist. Portland police say that since hard drugs were recriminalized September 1st, they had roughly 225 interactions with people using them, and 97 people chose to go into deflection. County data shows 91 of them decided to go forward with that process. Police didn't have a place to send people until October 14th when the center opened. So they did mobile deflection, where they met with people on the street and tried to refer them to services. For the deflection center itself, Multnomah County only has data for the first 2 weeks it was open, between October 14th and October 31st. They say in those 2 weeks, there were 19 referrals from law enforcement, and 13 of those started the deflection process. But the county says those 13 people received 32 total referrals for housing, treatment, and other help. Different services can count as different referrals, if you're wondering. Whether or not those 13 people will successfully complete the deflection process remains to be seen. They have 30 days to follow up on their referrals and check back in with the deflection center. While service providers say they've seen some positive cases so far, they say there's still a long way to go to actually provide the level of help some people need. Tony Vesna runs 4D Recovery, one of the treatment providers connected with the deflection center.
One of the big problems is, and everybody's aware of this by now, is that there's a lack of overall resources in the continuum of care. And so, we have a deficient ecology of services for people. So people can't always get the services they need when they want it. And that can be a big barrier to care. But, through House Bill 4002 and, our elected leaders, including our governor, more resources have come online. And I believe more resources are on the way.
In order to successfully complete the deflection process, a person has to follow up on one of their referrals. The county says they could be referred to drug treatment services like sobering and detox, withdrawal management, outpatient treatment, peer services, or housing navigation. But even if they do not go through drug treatment, but follow up, let's say, on a housing referral, that would still be considered completing deflection per the county's standards. The county says they plan to release bi-weekly deflection updates along with quarterly and yearly reports. Up next on the story, Portland's odor ordinance will soon change, and it's all because a restaurant in Northeast was forced to close because of a neighbor's repeated complaints. What's changing and when the story returns. The KGW Great Toy Drive is going on now, and you can help us support thousands of kids this holiday season. It's easy to give. Just drop off a new unwrapped toy at any IQ credit union, Fred Meyer, or local Toyota dealership. Or we have a special collection event this weekend. Members of the KGW team will be at the Washington Square Mall on Saturday from noon to 4. Come say hi and help bring a little joy to local kids. To the city of Portland now, where the months-long saga and outrage over a Vietnamese restaurant forced to close due to odor complaints has sparked change. This week, City Council passed a proposal to adjust the city's odor ordinance, with the biggest difference being that restaurants will no longer be subject to odor code rules starting in March. The drama over the odor code started back in February of this year. Pho Gabo in Northeast Portland was forced to close after fines started to rack up due to a neighbor repeatedly complaining about a smell coming from the restaurant. A city inspector told Eddie Dong, the owner of Pho Gabo, that he could buy a new air filtration system for $40 grand, but warned even that may not stop the complaints and therefore the fines. So instead of risking that kind of money and investment, Dong closed up shop. That's when City Commissioner Carmen Rubio got involved, leading to these now approved changes. Here's the full scope of what will change when the new rules take effect in March. The big one, retail and service businesses are no longer subject to the odor codes. The businesses that are still subject to the law will get 30 minutes of continuous odor emissions per day instead of 15 minutes as it's now. And if someone wants to complain, they have to live within 150 feet of the property line of the business causing the smells, and at least 5 individual complaints from 5 or more people have to be filed within a 30-day window before an odor investigation begins. The impact of city rules, regulations, and special programs often do hit small businesses the hardest and can lead to them either shutting down or moving out of town, an example we just gave. And that is also the case for a number of shops in Seattle who are fed up with a special garbage removal program. Can you imagine having to pay hundreds of dollars for a single roll of special trash bags? Business owners say the program amounts to nothing short of price gouging. Bridget Chavez has the story.
This looks like a standard garbage bag, but it comes with a high price tag. Some business owners who are part of a mandatory safety program that affects their trash pickup and their bags say the high cost is making it hard to survive.
Hi there. Can we get you anything?
River, an event space in Seattle, is a magnet for all kinds of gatherings, bringing in crowds of all types.
All right, 1 Cabernet, 882. You can tap right there.
Tonight,
perfect.
It's paint and sip.
Thank you so much.
A lot goes into it, like catering, staffing, and cleaning.
Well, you want to do a trash run with me?
But co-owner Jessica Gajvoronsky says few of those costs are as expensive as getting rid of the garbage.
My most prized possessions are these trash bags. Aside from rent and utilities, my trash bags are the most expensive and valuable thing I have to pay for every month.
The hefty cost of trash service here is connected to a city program started in 2009 called the Clear Alleys Program. It's aimed at making 5 parts of Seattle safer: the downtown core, Pioneer Square, Columbia City, the Chinatown International District, and the Pike Pine Corridor. In these neighborhoods, dumpsters known to attract criminal activity have been removed, and instead, Seattle's contractor, Recology, picks up the trash a lot more often. 3 times a day.
Ready?
We talked to 4 small businesses who say the garbage service also came with sticker shock on their Recology bills.
If somebody ever breaks into my business, the last thing I want them to steal are my trash bags.
This is the cost. $346.20 per month for a roll. That breaks down to $8.20 a bag plus a service fee. And if you need more bags, you're dinged again. $205 for another roll.
She's like, oh yeah, the bags are like $300. I was like, haha, that's funny. I was like, she's like, no, they are. I was like, wait, like you're being serious?
Just a few miles north in Seattle's Roosevelt neighborhood, where they don't have the Clear Alleys program, businesses pay a fraction of that. Gajvoronsky's husband,
Gotta break those down here.
Michael, owns Santo Coffee. He uses more bags a month, but pays less.
Oh, cardamom latte?
A flat rate of $240. At River, if they used the same number of bags, they'd pay more than 2.5 times that, nearly $700.
Feels pretty unfair that small business owners, they're bringing something special, they're bringing a culture to the downtown area, but then they're the ones who have to pay the extra fees. It just doesn't feel fair.
The city tells us the entire cost of the program is built into the cost of the bags, including the truck, driver, and disposal, but they would not provide us with a cost breakdown.
For that price, you think they would have someone to deliver them on a silver platter,
And businesses don't really have a choice. If they don't use Recology's bags, they get a bigger bill. At times, it's been so expensive they haul away the trash themselves.
There have been a couple of times where I've had to use my own trash and take them off site, put them in my car, which is gross.
The city told us Recology bags are thicker than regular ones, but at River, the owner says they fall short.
Oh, broke.
For the price, business owners say they should get excellent service, but instead, they say they get the runaround. It's even hard to get the bags on time.
I was on a call with Recology leadership to try to really understand the reasoning behind why it's so expensive, why it takes so long to get the bags. And they said, no, you should be getting your bags within 2 days. And I literally laughed in their faces. What do you mean 2 days? I would be lucky to get my bag order in 2 weeks.
The city says it welcomes feedback and they're ready to help if customers reach out. And that's what Guy Voronsky did. In the last 6 months, she's emailed Recology 10 times saying she's desperate for more bags and says she's made even more phone calls, but it didn't help.
I asked the city person, should I do a petition, like an official government petition? And they said you could, but it's going to take too long, go to the news. We're trying to revitalize this area to be another artist community, another art district, and stuff like this can get us to move out? Maybe.
Do any of you small business owners here in the Portland Metro deal with any programs you see as a detriment to your business when it's supposed to be helping? Email the story at kgw.com or call and leave a voicemail, 503-226-5090. That is the end of our show. Thank you very much for watching. For those of you watching live on TV tonight, the good stuff is up next. Pat is set to be back with you tomorrow. Hope you have a great night.